Today, we're joined by Rectangle Health's Chief Technology Officer, Mike Peluso. Mike, thank you for talking with us on the podcast, and we're looking forward to hearing more from you on patient financing options, especially Care Now, Pay Later. Let's jump right into it. Mike, what's the problem facing healthcare providers, and why is it so important to offer patient financing solutions to them?
Thanks, Michelle. I think the two biggest problems are the barriers to getting patients in the door. And right now that's amplified by one, the pandemic. We need to get patients back in the door. And then two, the overall cost of care is a barrier. Meaning not only can we actually not get patients to walk in the door, but patients are now saying that it's too expensive to walk in the door, or I don't have the $1,000 today to walk in the door. So I think that overall idea of the pandemic is keeping everyone home, which we all know is going away very shortly. And that idea of the cost of care is very expensive is really the two biggest problems facing providers.
That makes sense. And there is a more mainstream feel for things that are called buy now, pay later, or bank issued credit being more available in the healthcare industry, while payment plans haven't been as widespread and further adopted. Why do you think that's the case?
Well, I think buy now, pay later and patient financing they're the hottest item going inside of healthcare and outside of healthcare. We can buy anything these days and not pay for it upon purchase. Patient financing, or as we say it, patient financing, where the provider is putting the patient on the payment plan and the provider is, for lack of a better term, extending the credit, has always existed in healthcare. This isn't something that's brand new. It's not as popular as the term buy now, pay later, or it's not as popular as a company like Affirm. It's been there. It's always been an option, but it hasn't been as popular, or hasn't been as in the mainstream media recently as things like buy now, pay later, or take your care today and get a bank loan tomorrow to cover that care. It just hasn't been amplified as much, but it's always been there. I like to pick on orthodontists. Orthodontists have been doing this type of thing for a very long time. Hospitals have been doing it for a very long time. Hospitals have always offered payment plans to patients where the hospital will send you a statement every month and you can pay a small portion of your bill. So it's not anything new. It's kind of been overtaken by recent trends in the term buy now, pay later.
Right, and there's one distinguishing mark that differs between non-healthcare and healthcare, and it's care. Mm-hmm. And you've coined the term care now, pay later. And we'd love to hear more from you on what makes that the right way to do patient financing for both patients and providers compared to other types of financing that's out there.
Yeah, I think the best way to say it, and you said it, it's care. We want to keep the care between the provider and the patient. And if there's a way for the provider to do that and not involve a bank and not involve a third party, then that's most likely the right way to do it. And that's why we say care now, pay later. We want the patient to have a relationship with their provider, not with a bank. And the other thing that's kind of interesting about care is it's not a one-time thing. If you buy a TV, it's a one-time thing. You buy a TV, you own a TV, you finance it over time. If you go to a provider, and let's say it's a cardiologist or something like that, odds are you're going back to that provider at another point in time. So the care is continuous. So it's not a one-time, buy it now, worry about it later. So you want to care for your patients, providers, and providers or patients want the care. So to combine the two of them in a way that doesn't involve a third party, like a bank, I think is the best way to handle those items that we talked about early on of getting patients back in the door, and getting patients over that burden of cost.
That's awesome. Thank you, Mike. We look forward to hearing more from you on how Care Now, Pay Later can continue to help both the patients and the practices.
Awesome. Thank you.